right, so welcome to the Latino Behavioral Health Coalition podcast series. This is a space where we want to share some, learning and educational information. This in prep for our second International Mental Health Conference that's going to be held this November 11th through the 13th at the Marriott Aloft Hotel in the Santo Domingo, Dominican Republic. We're very excited about this conference that we're hosting this year, and the focus is on trauma and its impact on individuals, families, systems. It is an opportunity for us to learn and collaborate amongst professionals, stakeholders, people who are invested in trying to really combat, eradicate this issue, this health issue that is impacting many people all over the world. So we're looking forward for all of you to attend and support us, and to really get you engaged in what we're doing. We have two experts in the mental health field here today joining us, Dr. Eswar Kumar Dayanandam and Dr. Andrea Ettingoff, who will have the pleasure to get to know a little bit today and really have an opportunity to get information from their perspective as professionals in the field. So welcome to both of you. Okay. So I'm going to start with something very simple. Dr. Ettingoff, if you don't mind talking about yourself, what you do, how is it that you became sort of come into this profession?
Into the profession?
Into the profession.
Okay. Well, I am Andrea Ettingoff. I'm the clinical director or the director of clinical services at Children's Crisis Treatment Center. And my background is school psychology. So I spent the first 10 years of my career working in the school system in the Philadelphia area and serving children who had special needs, children who had behavioral issues, supporting teachers, supporting the other staff, and went on from there to work in an inpatient hospital for a little while in private practice until I came to CCTC, Children's Crisis Treatment Center.
Wow, what an impressive record. And
thank you.
Sounds like you've really dedicated yourself to work with children throughout your career, as a school psychologist and then now at the Children's Crisis Treatment Center.
Even back in high school, I was interested in working with children. I was involved in a special project working with kids with autism. And from that program on, I was going back and forth between psychiatry and psychology, which one did I want to major in, and what field did I want to pursue. But through my college training and all of that and beyond, I settled on, but it was never a question. I always wanted to work with children.
Wonderful. Well, thank you for being here with us today.
You're welcome.
Dr. Dayanandam, may I ask you the same question? What led you to be where you're at today in the field?
So I started my journey I did my medical school in India, and then I came to United States and did my residency in New York. After doing the general psychiatry residency, then I got trained at CHOP, Children's Hospital of Philadelphia, for child psychiatry. So as a part of the child psychiatry rotations, I used to come to therapeutic nursery at CCTC, Children's Crisis Treatment Center, right? So I was really impressed the way the program functions and what I gained the knowledge and how we are serving the family. And so that really gave me to work with this population. And also finally, I was so lucky to find a job there in CCTC again. So since then, I'm at CCTC, and it's been, I think, more than 10 years now.
Wow.
And I'm currently the medical director at CCTC.
What a wonderful trajectory as well for you. And it's very enlightening, I guess, because, my experience of physicians per se, when you think about, you're a psychiatrist, it's a medical doctor, it's, to have someone to spend time to sort of get to know children, their patients, their children and families in your case. It's enlightening. I think it's very rare sometimes.
It is very rare, but it was very rewarding because I was able to see the kids. I would go to the classroom, was able to see them, sit down with them, see what is going on, rather than just hearing out from the behavioral health workers. And definitely we get all the information from the clinicians, but being there and seeing in the classroom, and then coming and working with the family, and if you are seeing some good change coming out, that you feel really satisfied, like you feel like you accomplished something. And then you can see a good improvement. Even the kids where we felt like, oh, he needs a little bit more services, he needs a little bit more family support, but end of the time when they are staying at therapeutic nursery and getting out, you can see a significant improvement that shows that some kind of a support system which we can install either with the family, with the child, and we are doing some difference in their life. I think it makes a big impact.
Wonderful, wonderful. And that's very important, especially with the topic that we'll be discussing today around trauma. And I think that, I'm sure it'll come up again where we're going to talk. I'm sure both of you will mention sort of that importance of that support system in order to be able to overcome the impact of trauma. But thank you both. And what an honor it is to have you both here. So as you see, I think we're going to have a wonderful discussion today around, trauma with these wonderful professionals that have joined us for this podcast. My name is Ismael Alvarez. I am part of the membership team at the Latino Behavioral Health Coalition, which is a group of about 7 organizations and growing. Really coming together to talk about the needs and how these needs need to be met in specifically the Latino community that these organizations all serve. It's about creating awareness and having people understand the serious nature of the needs in this community, especially when it talks about mental health and social services. So with that, we're going to go right into, our conversations with these 2 wonderful professionals. And, start with, I'm going to ask both of you sort of to help our audience understand what does it mean to be in trauma or to have trauma, or what is trauma?
Oh,
Dr.
you're calling
Ettingoff,
on me
I'm
first?
going to start with
Okay.
you.
So everybody has some trauma in their life, obviously. And I think when you think of trauma treatment or somebody who's been traumatized, it's a more severe situation. The definition of a traumatic reaction is that the person's actually perceived their life actually was threatened, or they perceived that their life was threatened in some way. But there's also the situation where this could be because something did directly happen to you, like you were in a serious crisis situation, or it could be vicarious trauma where somebody's talking to you about it. And you begin to feel, a lot of us in this field, we're very empathetic. We could walk in somebody else's shoes very easily. And with vicarious trauma, it's actually, you feel like you're hearing about something. Like you could be hearing about something nationally in our country or in other countries, and take on the feelings of those who actually physically were there and experienced it.
Dr. Kumar,
So,
you want to add?
just piggyback on what Dr. E was talking about. So sometimes, say for example, they're coming for seeing a psychiatrist, right? Like, I'm assuming they already did therapy and they're in therapy and they need, some people we see they're in therapy and then coming for medications if something is not working, and if they're not seeing a good benefit. Or sometimes we see people, coming for medication management right away. But I feel like sometimes we encounter where they do not recognize trauma. They just see like this is kid is coming in, they have this symptoms, I don't know what is going on. Then when we sit down and really see, then we can bring their attention towards how trauma can impact the functioning of the child in a different ways. Trauma can come out as ADHD. because some kids will like very hyperactive and vigilant, hyper vigilant, running around, don't know what to say, like their reactive behaviors are very hyper arousal symptoms. It always almost mimics like ADHD. So the parents might think, oh, he has ADHD, but they're not really taking into consideration what this kid has gone through. So as a psychiatrist, I think, and as a community, I think we should be trauma informed. So being trauma informed and then trying to educate the family to try to bring it together. What are the things is impacting? Because like what Dr. E said about the definition of trauma, I totally agree. Like trauma is kind of a very significant event. Either it happened to them or they witnessed or exposure to kind of domestic violence or any vicarious trauma, but it's affecting the functioning of the child. That is when it becomes traumatic. So it's with all this. So trauma can, in a nutshell, I would say like trauma can come out in a different ways. It could be a severe anxiety. So they might have a little anxiety, but it got worsened. Trauma can come out where some of the kids, they thought he has psychosis. They thought he's hearing voices, he's seeing things. And everybody's worried like, oh, there is a family history of schizophrenia with my family. So now people are already thinking about he's having some psychosis for a 6-year-old or 7-year-old. But they totally forgot about how trauma can present itself with hallucinations and delusions and what we should do. So as a psychiatrist, I'm like trying to bring the community to know, the family to know how the trauma can, really present itself.
It seems very complicated, I guess, right? Because if it can be masked with other symptoms, diagnoses, from what I'm understanding.
Yeah.
So how is it then you can go about to really help people, children, or people who experience trauma? And I'm assuming that trauma, I mean, you mentioned several different types of trauma in your discussion. Is it one traumatic event or multiple traumatic events that people experience? How can you really discern that the symptoms are not something else and it's trauma?
Yeah, I can. What I can say is like having a good discussion with the family, like sitting down and discussing with the family and having an idea, put in the thought with the family that sometimes we see like fix my kid. They come with the notion of, oh, there's something wrong. We are doing everything for him. I don't know what is going on with him or her. It's not really helping. We need your help. But rather like trying to sit down and work with the family and trying to bring them like insight about what is causing all this stuff. There could be multiple factors. We are all born with the genes from our parents, and that's definitely carrying that. On top of that, if this trauma is impacting, and then how that whole thing, the narrative changes, bringing that insight with the family, one. And next thing is, I would say like trauma, the first line is therapy. First line is therapy, like supportive therapy. Then you can do cognitive behavioral therapy. I think Dr. E can really talk about that. And then you want some trauma-focused CBT. There are so many EMDR. There is a lot of therapy there. I feel like that is the first thing is trying to bring insight about trauma, then starting with therapy. And then if really needed, if there is other symptoms are so severe that it's affecting the functioning of the child in one way or other, then maybe adding little medications and will be a way to approach. And but with all this, like we need the family to understand what we are trying to achieve with this.
Yeah, well, and again, I think this is why we're doing what we're doing as a coalition right now, and why this conference that we're presenting in November is so important to us, because it is about creating that awareness.
Right.
To then start thinking about ways that we can heal or help people heal from the impact of trauma. Thank you very much. Dr. Ettingoff, you want to add to that?
Yeah, I just wanted to add an example of what Dr. Kumar is saying about a trauma. The symptoms of trauma can appear much later in childhood or even in adult life. And that's the issue, that somebody might come to us and say, my child's hyperactive. But that's why you need that conversation to see, is it something they were born with or inherited, or it's just who this person is and how they function, or did something happen to them? And I'm just thinking, as he was talking, of one example that a coworker of mine she was talking about the school I was working in at the time, and she was saying, "Oh, this teacher is telling you there's problems with some kids in her class, but that teacher is very overreactive. That teacher was telling me my son 3 years ago seemed depressed, and he had his head down at the desk much of the day. His grades were dropping, and she wanted me, a therapist, to take him to a therapist." And I said, "Wow, like what was going on?" She said, "Nothing was going on. Everything was the same in our lives. His dad and I had split up 2 years ago, and he had adjusted to that already. So nothing was really going on." And I said, "So who else was around at that time? He's your youngest. Who else was there?" "Well, his grandfather had just died that year." And that was like a light bulb going off. She hadn't even, all these years later, she hadn't thought that there might have been a connection, because in the adult world, well, he knew his grandfather was sick, and that was going on for a long time, so it was expected. So as an adult, you think, well, okay, that wouldn't be a trauma. But for him, that losing his father through the parents divorcing, and then the male figure he was closest to his whole life had passed away. So what can you do now? Now it's 3-4 years later, and she's realizing that she was sensitive enough to go back to him and say, "Hey, maybe there's some stuff in your life you haven't really
Resolved.
gone through, and would you like to reconnect with the therapist?" And he said he would. So, just that aspect of understanding. Now, I can work with somebody for a few years and not realize something had happened earlier, because everybody has kind of pushed it under the rug, or it was assumed to be not a factor. But everybody's temperament and biology is a little bit different. So everybody reacts differently. And some people you could have one child who's fine with something happening, and another child in your same family a year apart is not reacting so well. So that's why understanding the story is so important. And it takes time, especially with children, to get the full picture.
Wow. And what are methods or modalities of therapy that you utilize to be able to get to those stories? What are some of the best practices, if you will?
Okay, so I suppose I'll start, and then we'll go on to Dr. Kumar's area of expertise. But most parents, I would say, would start with a school counselor. If something has happened, let's say there was bullying in a school or something's happened in the family, they're going to start with who they're familiar with. But then that person or the pediatrician, somebody is going to refer on to, a professional if they see that it's just not resolving on its own, like the child's having nightmares, or their social interactions are impaired, or school grades are going down. So if they see something going on, most people would start with somebody they're familiar with. And then if they're referred, they might go to a therapist. Therapists have different ways of different theories, that they work under. One of the most commonly used forms of treatment is trauma-focused CBT, cognitive behavioral therapy. So it's taking a well-studied, evidence-based type of therapy that's pretty much standardized into a format. However, all of the therapists are flexible. So if a child is younger, they modify it to their age, or if the child's just resistant, or the child is very open, they can move slower or faster depending. But the trauma-focused cognitive behavioral therapy is a little bit different, because they start out with just making sure everyone in the family is safe and the situation's stable, because you really can't work with somebody if there's other needs present. You need to make sure everything
that's
is
a must, you would say, to create that sense of safety.
Yeah, sometimes things happen, but you have to restabilize, right the ship, basically. So making sure everything's okay, teaching a few calming tools to the child, reducing their anxiety. There might be a pressing issue, like they're afraid to go to school now or afraid to separate from mom. So dealing with that pressing issue. But once you get past that, then developing what's called a trauma narrative, where the child maybe creates a storybook or a picture book, depending on their age, and goes through what had happened. Like, let's say they experienced a house fire. They might go through drawings of what their house did look like, and what their family was doing before the fire, what happened during, and then what happened after. Maybe they moved somewhere. So going through that narrative and processing it with an adult that it can help them to sort out which feelings are to be expected and which feelings might be, based on some kind of cognitive distortion, some kind of thinking that, oh no, this is going to happen again, or I'm never going to get past this. But helping a child to reorient their thoughts and their feelings, and then that would be reaching the goal, toward ending therapy. But with anything, it could crop up again.
Mm-hmm.
But hopefully, the child becoming an adult now is given the tools to handle anything that might come up that might trigger thinking back to a bad time.
Yeah. Interesting. So that process that you explained, thank you very much for that information. As you're speaking, what I'm thinking is, what comes to my mind is, as they're processing, as they're creating that narrative, we're talking about those experiences. Is there any concern that by talking about them again, that can be very harmful or detrimental to the child or the person speaking?
I think that is the natural reaction for parents. And there's also other family members involved. So let's say the dad thinks that's a great idea. Like, let's talk it out. The mom thinks no. Like, no, let's just get back to school, get back to daily living. Both are really right, that there needs to be some normality, going back to normal life as soon as you can. But there's just no science behind if you bury it down, you'll be okay later on. It's very much the opposite of that. But you'll especially find in extended families that there'll be aunts, uncles, grandparents who, I hear it every day at work now, that there's somebody who's objecting. And I think it's important to bring those family members in to the treatment if you can. Sometimes you can't, but if you can even just get them once, to get them on the side of helping the child along, or if they won't come into the office, finding a way that the mom and dad and the child can sit down with that grandmom and talk about why they're going through treatment, what the point is of it.
So the bottom line is, it's difficult to have to go through, but facing it head on, as long as you, from what I understand, create that sense of safety
right
in the environment, that is very important to have to process, to do.
Yes.
Thank you.
You're welcome.
Dr. Kumar, you want to?
So I think Dr. touched on a lot of really good points. The one thing which comes to my mind, on the medical side is, so how we developmentally, I'm thinking about the brain and how we are learning things is from our past experiences. So, so we had very detrimental experience, very, traumatic experience. And then you don't resolve that, you don't talk about it. So you create that kind of unknown reaction subconsciously, something related to that. So any kind of things which is related to that, you're going to face in future, you're going to react either overly, or you're going to avoid it, or you're going to react overly. So you will see different kind of reaction. So sometimes we see the kids when they are reacting to those. So that's where we come in, and we're trying to see where this all started from. Why this kid doesn't, listen to, for women, but if he has a teacher, the male therapist, he responds, but with the female therapist, he does not care. Or some kids are very aggressive with the girls, not with the boys. But they are fine. They're doing really. So where is this kind of a really unwanted reaction is happening? From what is causing? What really caused? From where did you learn how to treat girls and how to treat women? So was there any exposure? Then if you really dig in, you can really see some kind of because a lot of kids learn from modeling. We all learn from modeling. That's how we're all, that's how one of the nature of the human beings, we all learn from
the good and the bad.
Good and the bad, you're right. So that really forms the base in our hippocampus, and then we are getting back that whole reaction. And so, like Dr. said, resolving that at one point, any time, bringing that up, talking it out. Even though they don't feel like talking about it, but preparing them. That's what the trauma-focused CBT is. They don't not jumping into narrative right away. First, you got to fix all the psychosocial factors. There are a lot of families whom we are serving. They don't have housing. They have financial issues. So we got to work on those too before working on the trauma, because you want to work on trauma, but they're not. Their mind is completely occupied. Like, I don't even know where I'm going to sleep today.
Wow.
Housing situations, or they're going home, they're in the shelter, they don't know what is going to happen, or if the kid is with the foster care, they don't know whether they're going to stay here, as the kid is going to move. When that kind of unpredictability is there, and then they cannot even focus with the trauma work as well. So working on that, and then working with the trauma piece, and so that stabilize the whole family, I think will bring up a good results.
Wow.
Yeah.
So it is about really considering all these factors, the sense of creating a safe environment for people, children, or people in general to talk about what has happened to them, and then just being able to set that tone for them. And what a wonderful sort of interesting, both of you, because you have sort of a school psychologist by profession and a psychiatrist here, and and it's been very impressive to hear sort of the way that issues of trauma are tackled using trauma-focused cognitive behavioral therapy. And as a psychiatrist, though, it's interesting. I'm not hearing you talk about medication that is used to treat trauma. Is there medications that treat trauma, or how do you approach that?
So that's a good question. And yes, I'm getting there. The medication is always, when we talk about medications, it's like kind of a very scary thing. I'm a parent too. So if I have to put my child on medications, I'll be worried as well. So that's a common reaction we get. But again, there is FDA approved medications, different serotonin, we call it selective serotonin reuptake inhibitors. So we use that to help with the trauma. That's one of the FDA approved medications. But even before that, what I've learned over a period of time, like with working with my experience, there are lots of other medications. Especially I bring this up like an alternative medications, where when the parents are worried, like, I don't know if this medication, I don't know what about the side effects. I read up a lot about side effects in the, nowadays in Google, you can put up the medication name, they're giving you all this information, and even in TikTok and everywhere, people talk about medications, and then the parents get really worried. Right before even starting right before even starting the medication, they're looking for a negative effect from the medication rather than the positive.
Right.
So then any small reaction, oh, he's not sleeping, oh, he's not eating well, maybe it's from the medication, maybe it happened one day, maybe he didn't like it, what he took for his lunch. So, but again, things like that really creeps in. So then for a period of time, like analyzing the population, and now even here we have lots of researchers working on alternative medicine. There are like tons of medication over the counter, which will help for anxiety, which will help for depression, which will help for any kind of impulsivity for the kids who are going through trauma, help for sleep because of all these arousal symptoms, what they go through in trauma. Their sleep is affected. So I'm not even talking about melatonin, but there are lots of other over-the-counter medications which really helps for in different facets of trauma.
So, and it's interesting because I understand that both of you are co-presenting at this conference, the Latino Behavioral Health Coalition's second international conference in the Dominican Republic on alternative medicines. So when you say alternative medicines, I'm thinking herbal medicines or what have you. Is that what you're talking about? Or you also mentioned over-the-counter. So
And yeah, I would say like nowadays they are actually terming a new name, like it's called nutraceuticals. Instead of pharmaceuticals, I put it like nutraceuticals. And University of Arizona is doing a huge work. They even started a fellowship for, we call it integrative psychiatry. It's called integrative medicine.
Okay.
Like how we have in the medical side, we have functional medicine. Now actually they're starting even functional psychiatry. So there are different fields are evolving right now from the traditional psychiatry offshoots. And integrative psychiatry, I feel it should be the pillar of psychiatry. It's not only medications, we are integrating like movement therapy, like yoga, like other natural vitamins. There are so many vitamins which is very specific for mental health, which helps for anxiety, which helps for depression. I'm not even talking about something like herbs, some Chinese herb, even China. Nothing wrong with the Chinese herb. That are really good. If you take a really good medication, it does help. But I'm talking about really available in our pharmacy, regular pharmacies. There are lots of vitamins. There are lots of other micronutrients. We call it micronutrients, which not a lot of people are focusing about. And there are only few pharmaceutical companies who are really working on that as well. So I have a lot of research papers about that, and then I feel I've started some using those medications in a CCTC where some families can afford them, and once they are able to see that, now there are a couple of families like we don't even prescribe any regular anxiety medications. Wow. They're just using regular vitamins, and nowadays I get evaluations only for vitamins. And I heard that you do vitamins. So can you do an evaluation? So this is what I recently got an evaluation. So I was like, okay, I'm like very happy about it.
Change in the field, Dr. Kumar.
Yes, yes.
That's wonderful.
Yes.
And Dr. Ettingoff, how is it that you're co-presenting? How is it that what is your, I guess, contribution to this sort of
alternatives?
Yes.
Well, I think it's important. Therapy, obviously, I'm going to be pushing that, because I think it's so important to go through the trauma narrative if it's possible. But the supports in your environment are equally important. And for some kids, it's natural. They have large families. They have family meals and gatherings, and there's a lot of support there. But for others, they're more isolated. So joining a program like a yoga class, a Zumba class, which I'm very familiar with,
yes,
got me through the pandemic, and equine therapy, which is therapy with horses. Their programs, children connecting with animals is very important. I heard one man speak who said he was just so. He had been abused for 5 years by his stepfather, and once in foster care, he really just couldn't connect to anyone until he finally connected. He went to a foster home on a farm. He was the only child there, and he connected with the chicken. And that connection with the chicken, going out to see the chicken on the other side of the barbed wire fence, just like kind of brought him a perspective of what life could be. And he's become an international speaker and musician. So those kinds of things. There's other alternatives also, like acupuncture. There's acupuncture in the ear that some people with PTSD really feel very strongly about, a positive effect, because your ear kind of reflects your whole body, and all the acupuncture spots. It's a little easier to take a piercing in your ear.
That radiate all over your body, right?
Or you could use seeds. You can actually buy ear seeds and instructions on Amazon. But there's all kinds of alternatives that I think a lot of people think there's a placebo effect, that maybe it's just, they think it's helping and it's not really doing anything. But there are many studies showing adding that to a traditional treatment has a real plus, a real bonus.
Wow, so very interesting work that both Drs. Ettingoff and Kumar are doing and collaborating on, and I think that this conference is going to be very informative and really help people understand the different ways that we can really work on healing from trauma. And on that point, you mentioned something earlier, Dr. Ettingoff, around vicarious traumatization. And I wonder, as professionals in the field and having to work and listen to these very sometimes horrendous stories of trauma, how do you stay healthy yourselves? How do you take care of yourselves as providers of this work?
That's a very good question.
Yes.
It is a stressful job. I would say that where I work now, Children's Crisis Treatment Center, we are following a model of being trauma-informed, which is not a therapeutic model, it's an organizational model. So within that model, we all have safety plans. I'm not wearing my badge right now, but our badge One side is our picture and who we are, and the other side is our safety plan. So if we're upset or whatever is going on, you had a difficult conversation with somebody or a troubling conversation or something triggered. I'm talking to a child who went through this, who did go through the same thing I went through at a young age. After I've done my part, I might like take a moment, look at my safety plan and say, all right, this says go talk to a peer. So I go over and to your office, let's say, and talk to you. So having that, also having a self-care plan. We all, as part of the model, we all have a longer, more extensive self-care plan of what we do to chill out. We check in with each other before every staff meeting, every family meeting to see how we're feeling and offer support to each other. So there are many different ways, but that is really critically important for, I know there's going to be a lot of young professionals or interns, students at the conference, and it's just important to be aware of that early on, that you need to do what you can for yourself, so you don't deplete all your energy with all those wonderful feelings that you carry for other people and hold for other people. So, so I think for where I work and where you guys work, it's that feeling of support, that we support each other and carry each other.
Wonderful. And I think that's what we all should be doing, right? In life, just being able, what a wonderful way to be able to sort of, if we could all carry our own safety plans and make sure that we muster up the support of those around us to be able to manage stress, daily stress and adversity. So thank you for that. Dr. Kumar, do you want to add to that?
No, I think Dr. E touched upon all the stuff. The other thing comes to my mind is like current situation, like with the eyes and all this, what the kids are hearing about it and what the families are going through. And sometimes I recently saw a kid like in the suburbs where her family is not going through it, but she's so worried that all her family members go to this grocery store where things got really worse and they all got pulled by the cops, and so she's like having panic attacks. She's really thinking about it. They're going to come to their house, but their parents are saying, no, it's not happening to us. So sometimes I feel like with especially with that family, we had to say like, maybe we have to switch out the TV a little bit. That's where some of the time where that is instigating, that is creating so much of reaction to this child, and cannot focus, cannot go to school because she's worried that they're going to come and take her parents out. And
it's a scary world that we're living in right now.
It's scary, and that's where when you feel like you're not safe and you don't have control over it, you can't do anything about it. Then you get all this significant reactions. So when those kind of situations, we as a team, it's not only my idea, it was a team idea there in Montgomery County office. We decided, okay, maybe we should tell the parents like, or no social media, no electronics for now, a little bit. Maybe let's see how she takes it in, because it's not happening. She's in a safe place right now. They're all good. They don't have any issues. But sometimes this, just by hearing it out, this is happening here. My family members, my relatives, my friends are going through, hearing out in the social media, hearing out from the news, that brings up so much of traumatic reaction. We have to be, we have to be really cognizant about that.
Yeah. Well, again, it's that sort of safety planning.
Yes.
Supporting one another, that sort of camaraderie, if you will, between the professionals, the people working in the field. I think that helps be able to come up with those ideas, like, helping families say, listen, turn off the TV, stay home. That's
kind of a safety plan for this kind of situation.
Exactly.
Because that's a way to help the reaction to come down. Parents were saying, should we do any medication? Like, this is a situational which is creating the significant reaction. So we have to see where it is stemming from. And then you kind of, and when you understand the trauma, it's not like if I can prescribe so many medications for anxiety, but is it really going to help when you are not taking care of the cause of this whole anxiety? So working on the cause, and if it can be modifiable, can be controlled, will make a big difference.
Wonderful.
Yeah.
Well, this has been very informative. I thank you both for really sharing your expertise with us, with this audience. Looking forward to what you both are going to contribute to this second International Mental Health Conference in the Dominican Republic, this November 11th through the 13th. As we wrap up, I just wanted to get a few words from both of you about what are you expecting to get out of this experience this November?
Well, this will be my second time going to the Dominican and your first time, I do believe. Thank you. And I mean, I just loved it because of the spirit of the people who are so excited and thirsty for information. So I just love being able to say what we do and to kind of compare notes, to talk to people about what they do, what their work is, what their concerns are, and learn about the culture. And it's just such an amazing and vibrant culture. So I'm just very excited to go, and great food as well.
Wonderful. That's a good motivator.
It is very motivating to me.
So
Dr. Kumar.
I'm very excited because I'm not against the traditional psychiatry, but I want to bring into this integrative psychiatry. I want to bring my knowledge. I want to share my knowledge. I want to invite everyone to come to, whether you're a therapist, whether you're family, or whether you're a psychiatrist or social work. I want everyone to come to the conference. I want to hear out there are so many things, so many vitamins, so many nutraceuticals, so many medications are there outside in the market which can be used, which is readily available, can be used towards treating anxiety, depression, any kind of a mental health. So I'm very excited. I want everyone to come in. I want to share my knowledge, and we should have a great session.
Agreed. So there you have it, everyone. From both Dr. Ettingoff and Dr. Kumar, right out of their words from their mouths. Come enjoy with us, learn, understand what this work is around trauma, and that there is hope, there's healing from adversity. And when you have wonderful people like professionals like Drs. Ettingoff and Dr. Kumar, that I hope you come and listen to, I hope that we can sort of impart that to all of our audience, that coming together, supporting one another, we can heal from the impacts of trauma. I want to also thank our amazing sponsors for this conference. Without them, without you, this would not be possible. So thank you for supporting us, and please, if anything that you heard this afternoon has impact in your lives as professionals, as stakeholders making decisions around, supporting this work, or just people who really want to learn more and help others, please come join us at our second International Mental Health Conference hosted by the Latino Behavioral Health Coalition this November 11th through the 13th at the Marriott Aloft Hotel in Santo Domingo, Dominican Republic. Thank you.
Thank you.
Thank you.
Thank you.